Well, it's not really that there are no cases of coronavirus in the island. It's that there are suspicious cases, but they have not been tested. So if you don't test, you will never find coronavirus in Puerto Rico. That's the best way of uh, making sure that there are no coronavirus in Puerto Rico is by not testing.
All right. So before we started this interview, the doctor sent me a couple of cases that he believes need to be tested for coronavirus, one of whom he is dealing with directly. Tell us about that patient, doctor.
Okay. He's a 71-year-old male patient with uncontrolled diabetes and a prior history of cancer, specifically a lymphoma. And he showed up in my clinic a week ago or so with the complaint that he had been having a fever for 2 weeks, associated with the severe dry cough and general malaise. So he received an influenza test. First thing you think of is not really coronavirus, because influenza right now is much more common in the island and also in the mainland United States. So we did an influenza test, which was negative. So the next thing I did was order a CT scan of the chest. Actually, I did a chest X-ray, a plain chest X-ray that was negative. But to detect coronavirus, actually the CT chest is much more effective than a plain chest film. And the CT scan of the chest showed multiple areas with what are called ground glass opacities, which is a typical finding of coronavirus. So when I saw that, I immediately thought that the patient could have coronavirus. We asked him about the contacts with the other possible infected patients, particularly uh, from the U.S., because we now know that it is in the general community in the U.S. He had not traveled to China or to any of the endemic areas like Italy. So I thought maybe he got it from someone that had traveled from the U.S., but he also denied any contacts, recent contacts from anyone who had traveled. His daughter and his grandson also had what was thought to be a common cold. The only the only thing in his history that was positive. So we contacted the Department of Health so that they could run PCR test for coronavirus. He met all the criteria that the CDC has some requirements that the patients should meet before they get tested, and he actually met all the criteria. So when I called them, I thought they were going to do the test, but they refused to do it. So that was someone from the hospital that contacted them, a nurse, which is kind of the usual procedure. So when he told me that they had refused to do it, I couldn't believe it. So I asked him, who do you talk to? And he gave me the name of the person. So I contacted that person in the Department of Health, and she told me that the reason was that she talked to her boss, who's uh, the state epidemiologist that works at the Department of Health. And I asked her what was the reason. So she told me that the patient had a history of having been in contact with his daughter, who had the common cold, and that was the explanation why he had this problem. And I couldn't believe what she was telling me. I told her, look, this is absolutely insane. I mean, this patient doesn't have a common cold. He has a very serious illness. He's got pneumonia, and he also has a typical picture, and is negative for influenza, and he's almost about to be intubated. He's in an intensive care unit. This is not a common cold. So then she told me, let me talk to my boss. And then she called me back and said that she had talked to her boss, who's a state epidemiologist, and that that was their explanation. I said, no, no, that cannot be. So I said, I cannot just stay here and not do anything. So I grabbed the phone and called the CDC offices in Atlanta, Georgia, and I explained the case to the person that I finally got to. Is a physician, very nice person, and I explained to him the whole picture, and he he acted, like he couldn't actually believe what I was telling him, and he didn't tell me that outright. But you could tell by the way he was talking that he couldn't believe that they refused to do it. So he told me that definitely the patient met all the CDC criteria to be tested. So I told him, well, I don't know what's going on, but I think there's some problem here in Puerto Rico because they refused to do other cases or to do all the PCR testing in other cases also. So he told me, let me call her and I'll call you. I'll let you know. So he called her, and a few hours later, she called me. The person here in the state health department called me back. I happen to know her, actually, and she told me that the the reason that she wouldn't order is because she was afraid that if she sent several cases that were negative, and that then they wouldn't be responding to her requests in the future because she was ordering unnecessary PCR tests. So I told her, look, it doesn't make sense. If you're following the recommendations, the CDC recommendations, I don't see why they would refuse to do your test. So that's the last thing. Then after that, I talked to her again because she told me she would call me the next day, and she didn't call me back. So I called her back, and she said then that she was going to look at the results that the blood cultures and other tests that we had done to rule out other possibilities like Legionnaire's disease, for example, or just a common pneumonia, like pneumococcus or chlamydia or other pneumonias like mycoplasma pneumonia. And if they were negative, then she might do the test. So that's where we stand right now. She told me she'll do it.
Have those tests been done?
They've been done.
And he was negative for that?
The ones that they have come back already are negative. The blood cultures were negative. Legionnaire's was negative also. We're waiting for
mycoplasma, sorry? Because mycoplasma has been an issue on the island, right?
Yes, absolutely. So that's pending also. But anyway, I don't think that this is a mycoplasma pneumonia. It's not the typical picture. I mean, the patient didn't have the usual symptoms that are associated with mycoplasma, including sore throat. He didn't have that. And his chest CT appearance is not that of mycoplasma either. So I doubt that's going to be positive, but we'll find out.
How is the gentleman tonight?
Sorry?
How is the man right now?
He's stable. He's in high flow oxygen, but he's holding his own. He has not had to be intubated. He's not getting better. He's not getting worse. So he's stable. But the thing is, that it doesn't matter if mycoplasma is positive or negative. The CDC does not require that we do a mycoplasma test. The only thing that they require is to have an influenza test that is negative, or to rule out any other obvious source of infection. But right now, the CDC has liberalized the criteria. They don't even require what they required before. Now, if the clinician who's taking care of the patient feels that the patient has a typical case of coronavirus, that's enough for them to run the test. So she doesn't really have to go through all these difficulties.
Doctor, your patient needs to be tested. And the reason I wanted to interview you tonight is I've been very careful not to include any stories that come from anyone, secondhand rumor, and especially someone who is not a medical provider. But when you reached out to me and I verified who you were and you told me the story of your patient, I wanted people to hear from you because that man, two things, that man needs to be tested. And second, medical providers like yourself are the ones who should be deciding when testing is done and not done.
Exactly.
You told me about some other cases. Are these other cases that you heard of, or are these cases that you were involved in?
I haven't been involved firsthand, but the first case that I described came to the hospital where I work, which is Auxilio Mutuo Hospital. And he went to the emergency room at Auxilio Mutuo. He was taken care of in the emergency room. And I talked to the medical director at the Auxilio Mutuo, and he gave me the details, which I gave you. So even though I didn't take care of that patient, I do know about his history, not firsthand, but from a reliable source.
So if you would I don't want to frustrate people, but I want to be very, very cautious. As much as I would like to tell those other stories, I certainly have no reason to not trust you. I would rather hold off and not tell those other stories because it's not firsthand from someone who is treating them.
Hmm.
If you are able to put me in contact with the provider who is treating them, I definitely want to tell that story, and I definitely want to see if they can be treated. Um, but let's stick to your case and circle back on that with a question. What is your reaction to how the federal government is handling all things coronavirus related right now?
Well, I think it's improving because at the beginning they were doing uh, very few very few PCR tests uh, compared to other places in the world that were doing it much more liberally. But now I think President Trump has been criticized about the way it's being handled. So they've decided to start kind of decentralizing the testing instead of doing it in the CDC in Atlanta. Now they're going to do it in the state health departments. So they are going to send out some kids that are supposed to be here anytime. I mean, they're supposed to be in all the states and in Puerto Rico also. And then the state health department is going to be testing instead of having it done in CDC in Atlanta. And soon also they're supposed to approve some kits that are commercial. So the hospitals in any place in the States or in Puerto Rico will be able to do their own testing rather than sending it to the state health department.
The state health department officials with it and officials with the governor's office will watch this interview. What do you want them to know?
Well, I want them to know that the best way to protect the island is not by refusing to do the test and saying that there's no coronavirus in Puerto Rico. I think they should identify any suspicious case and test them, and that way they can track down their contacts and put them in isolation and quarantine. But if you let these people uh, go undetected, pretty soon we're going to have a very big epidemic in the island, which is going to be much worse.
Is there anything I didn't ask you that you would like to add?
No, I think basically that's what I want them to know. That I'm really concerned because I think we need to start tracking down the contacts of everyone who's got coronavirus. If they don't have it, I mean, they do the test and they don't have it, fine, fantastic. I don't want coronavirus in the island, obviously. I would prefer not to have any cases here, but if we do have any cases, I think they need to be actually treated very aggressively. Not treated, I mean medically, but
Do
they
you
should be
need
handled.
do you need some type of quarantine because you came in contact with that patient, which you believe may have coronavirus?
Well, no, if the patient doesn't have coronavirus, but we should know early so that we can then put the people in quarantine. So I
Including
think that,
yourself.
of course,
Yeah, yeah. Okay. Listen, I thank you for reaching out. This is exactly what I was asking people for. I said I wanted to hear directly from a medical provider, and you reached out, and I appreciate you doing that. I will get this story out in hopes that this man will be tested right away.
well, I appreciate that. We actually love you down here in Puerto Rico. My daughter, who lives in Houston, I actually lived in Houston for 28 years before I moved back to the island. I used to work at MD Anderson Cancer Center in Houston. My two daughters live there, and the oldest one, when she found out that you were going to be interviewing me, my wife let her know because she's absolutely crazy about you. She loves you, and she told me, please make sure that you tell David that I love him. So I'm just transmitting her message.
Well, I thank you very much. Hello to her. I'm sure she will watch this. And again, my deepest gratitude to you because there were a lot of people who were reaching out to me saying, David, this is not true. The health department is not telling the truth. And I know there is a profound distrust of government on the island, but you all can respect, those of you who are watching this video, I hope you can respect the fact that I feel an incredible sense of responsibility not to mislead, not to add to fear, and not to take things that are kind of somewhat true. We need to stick to what we know from people who are directly involved, such as this doctor here who is talking to us. So, Doctor, conclude the interview, get off the phone, post it, and hopefully get them to test your patient.
Thank you very much. I really
Thank you, doctor.
appreciate it.
Thank you.